Chapter 18, Slide 1. In this chapter, you will learn about the foot and the most common conditions relating to this joint. These include retrocalcaneal bursitis, heel contusions, Pes Planus, Pes cavus, Plantar Fasciitis, bunions, and turf toe. You will also learn how to evaluate your arch and determine if you have a normal arch, Pes Planus, or Pes cavus. And you will also learn what type of shoes are ideal for such conditions. Please use the PowerPoints to guide you in your reading. Once you have completed the readings and corresponding PowerPoints for chapters 18 and 19, you can prepare the forms located under Session 4. Slide 2. Begin by removing a shoe and sock and locating a felt pen or dry erase marker. Check out the feet on Slide 2, all sorts of shapes and sizes. The old adage goes, the uglier and smellier the feet, the better the athlete. I'm sure we have some excellent athletes taking this class. Slide 3. Read and review the corresponding anatomy of the foot using the PowerPoints and the textbook as your guide. Locate the requested information on each slides. Audio will resume again on Slide 14. Slide 14. Press your thumb into your medial longitudinal arch and locate the prominent bone known as the navicular bone. This protrudes from the medial longitudinal arch. Using your pen, make a mark on it. Refer to the diagram in this slide for assistance. Now, lift one foot off the ground, and while lightly touching a sturdy object for balance, perform a mini squat by slightly bending at the knee of the weight-bearing leg. If your arch collapses to the ground, as seen by the movement of the navicular bone, you are considered a pronator, which means you have flat arch, referred to as Pes Planus. If your arch remains high and rigid and doesn't move, and also correlates with claw or stiff toes, you are considered a supinator, which often correlates with having a high arch. Please note on the PowerPoint the posterior tibial tendon. Visualize now the arch being flattened during pronation caused by flat feet. By doing so, you can understand how flat feet make one prone to shin splints. It is the posterior tibial tendon that is considered the shin splint muscle. This chronic condition oftentimes originates in the arch. However, most coaches don't realize this. The takeaway here is that we must address the arch, not just tape the shin when dealing with shin splints. Slide 15. If you have difficulty locating your navicular bone, you can also perform this test by placing your foot in either chalk dust or water, and then standing on a small chalkboard or on a lightly colored construction paper. Lift one foot off the ground, and while lightly touching a sturdy object for balance, perform a mini squat by slightly bending at the knee of the weight-bearing leg. Return to a normal stance with both feet on the ground. Then, carefully lift your test foot off of the board or paper. Based upon the appearance of the outline your foot made, you can now classify your foot type. Please refer to Figure 2 on the PowerPoint slide. Under dynamic conditions, the individual who maintains a high arch is classified as a supinator, while the individual whose arch flattens excessively is classified as a pronator. Slide 16. So let's discuss shoe wear. What brand of shoes are displayed in this slide? If you said Toms, you are absolutely correct. They are stylish, trendy, relatively inexpensive, and a way to provide shoes to those who cannot afford them. However, if you've ever worn a pair of Toms, you know how unsupportive they are for the medial arch. Keep this in mind as we progress to the next slide. Slide 17. So what is this brand of shoes? If you stated Converse, you're absolutely correct. Again, very stylish, but terrible in regards to arch support. Slide 18. Here's one of my favorites, the overly priced flip-flop, known as the Rainbow. This provides a bit more arch support, but not much. Slide 19. So, you walk in a store and wonder which shoe is the best. We can't provide a blanket response to cover all people. It literally is a trial and error approach. However, there are some basic generalities that can be considered. First, most Nike shoes run small and narrow, whereas most New Balance run wide in the toe box. However, the basic guideline is as follows. For those with flat feet, a stability or motion control shoe is recommended to provide additional medial longitudinal support. For those who have high arches, a cushioned shoe is necessary to absorb the additional forces that the stiff, high arch cannot. Slide 20. One might also consider consulting with a podiatrist so that a fitted, customized orthotic can be provided to support the arch that is inherently high or flat. Slide 21 through 26. For the remaining section, use the PowerPoints and the textbook to locate the requested information on the slide.